And then you can mess around with your table. Then you can go grab like total knee trowels, all that stuff. Okay. So show you all how to do the robot. All right. Open that up and work over your field. In this case, we're gonna make this your field. Yep. Put it right on there.
Remember your sterile. There you go.
Yep.
Is my table sterile? Yep, everything's sterile.
Now grab the inside, give me the packaging. Yep. Perfect. Okay. So set it down. You notice some blue tabs?
Yes.
Where are they? Which ones are you looking at? Those? There should be some over here, like on one of the sides. Turn it over if you have to. Yep. Okay. Notice that?
Yes.
All right. Turn it back over. Make that face you. So go do 180 the other way. Yep. Keep going. Keep going. Come on. Okay. So this is fan folded. So it's kind of counterintuitive when you unfold it. So take the top layer of that and unfold to your right. So to your left. Sorry.
To my left.
Yeah. Come over this way. Yep. Hold it. Keep going. Keep going. Oh, it's no longer sterile.
It's going this way.
Right.
What are you talking about?
So it's counterintuitive. It's going to want to go this way after that one. Come this way now.
So now.
Yep.
Yep.
Yep. There you go. All right. Cool. And then this one unfolds the other way. Yep.
This is thorough.
You see why I can't like put this back in the box
Yes.
afterwards? Yeah.
Okay.
All right. Cool. So now that you're here, all right. The way the robot gets set up two ways, it's different for right or left.
Okay.
And this arm will either be on your right hand side or on your left hand side, right?
Okay.
So right now it's on your right. So what you want to do is take the big tab and slide your hands, your right hand, right over it. Yep.
Okay.
And then you cross your left hand right over the top to the little blue tab that's right here.
Which under?
Yep, just like that. Perfect. Yeah,
Sure.
do that.
This one?
Yep.
This one?
Yep.
Are you sure?
I'm sure.
Okay, we're good. What am I doing? Am I
You're gonna come
holding
up. You're gonna come up and straighten out your hands.
it? Yep. Uncross?
Yep.
Right here?
Yep.
Okay.
So remember what he was saying, like trust your rep?
Yeah.
Trust me.
Morgan, just go with it.
Okay, sorry.
Don't ask. Don't ask. Do you know? Are you sure? That would be the worst thing to say.
Alright, so then all you have to do, seriously, all you have to do is come here and just get near these two, like this. Just do that. Alright, and that's that simple for draping this. So you know like a C-arm, you have to like go around, you don't get help, we actually will help you. So
That's nice.
this one says 2 arm, says it on my side. So all I have to do is now put it here, and you just gotta keep holding it there. And then come around to the side, do this one here. And then sometimes I'll even tell you, like, if you're really busy and you're going, I'll be like, all right, you can go, I'll just finish it, right? But if you want to help me, all we gotta do is get around this arm. Cool. So that's it. It's that simple. So you gotta get it there somehow. If you don't do this, which a lot of people don't, and I don't know, you know, I mentioned it, but I don't know why they don't do it. You're taking like 4 or 5 trips back and forth between your table and the robot. So if you do this, you get it all done at once. And
He hurt my back. Thank you.
Okay, so now you know, Brad.
Okay. Yes.
All right, so you can take the power. Yep. Set it on here. Take the biggest array of all. Yeah. Take the smaller blue screwdriver. Okay. The thing that was next to the screwdriver is a silver post. Yep. Take the X that we already set up. Perfect. Alright, what else? Alright, you're good to start. Okay. So then what you want to do is bring your MAKO up to the robot. Sometimes even putting it under works. Yep. Alright. Take the drape, slide it all the way on. Can everybody see am I in the way? Alright. So what you want to do is grab underneath it. Yep. And this thing is sturdier than you think. Don't baby it. So pinch it right in the center. Yep. Pull straight up in the air. Yep. Alright, I want to show you guys something now. This is unsterile. The whole reason for that little blue thing to be on there is to keep it sterile while you're setting it up.
Now the other thing is when you pull that off, this is unsterile. You want to just pull it off and hold it and hand it off.
Yep.
Don't put it on your nail stand.
Exactly.
Okay? Don't put it on
So
your
the
nail
way,
stand.
yep, you pinch it, and then seriously, if you drop it on the floor, I'd be grateful.
Throw it right on the
Don't drop
floor.
it.
No lie. Throw it right on the floor.
Yep,
Yep.
so
Yeah. So, alright, so you got rid of this. Now this part right here, pinch it underneath again. Make sure this part of the drape doesn't touch it. See, because that's all on the sterile now. Yep, so now you got that. Alright, grab, with your other hand, grab your power by the gray part. Yep, come on over. This open end is going to face out toward Morgan, right? Yep, just like that. Yep, put that right over the top. Actually, set it back down and switch the way. Or you can switch hands. You can switch hands too. Yep, exactly. Cool. See how that felt?
Yeah.
All right. So now use your index finger and start tightening those screws. Yep. Do the same on the other side. Cool. Grab the blue screwdriver. Now final tighten that. So as you saw, this is already swirling, so push that gray all the way away from you. Just push it away from you. Yep. Now you have easy access there. So tighten it all the way and then do the same on the other side. Cool. So take the handle, yep, 90 degrees again. Take that little clip, push forward, but put it right over the top. So the gray handle, like right over the top where it was. Yep. And see how it locked in? Cool. All right. So now, what you want to do is, I'm going to unlock the arm.
There you go.
Cool. And you can put that in your sleeve, like up your arm, and it just stays there. Yeah.
Yep.
All right. Cool. So I'm going to unlock the arm. You can push this out of the way if you need to a little bit. Yeah. So go ahead. Grab it. Yep. Don't be scared of it. Now turn it. Turn it to where it's like a gun, and it's going to shoot that way. Yep. Raise it up a little. Perfect. Right. Yeah. Hold the drape and then pull off that piece and literally just throw it on the ground instead of putting it on anything sterile. So you see how there's a hole on the drape?
Yeah.
All right. Look at the posts on the array that you're holding. So you see on the post there's like a black line right there over like longwise on the post?
Yeah.
Yep. Yeah. That black line is going to end up lining up with that keyhole.
The top.
Yep. Like that. So line it up with a keyhole. So turn it to line up with that. Yes. Exactly. Cool. And now push in. So use your palm. So strong. Push in and now turn to the right once it's collapsed. Yeah. That's it. Good. Now you pull in the center and then kind of try to move it. It's not moving, right? You're good. That's in place. So then, good job. Okay. Last thing here. You see the lock and the arrow? No? Put it how you had it. Yep, just like that. So the lock and the arrow, to lock it, just go opposite of what the arrow is pointing. Yep. Because the arrow is pointing unlock. So yeah. Cool. Alright. Good job.
Yay!
Alright, so now let's get another ball. Alright, so go ahead and hit the trigger and it's going to start moving on its own. Hold it. Yep.
Oh.
So remember how I told you all that there was like an optimal position for it to start? And you hit the trigger? So this is it. This is where it wants to go. Let go of the trigger. Yep, let go of the trigger. Alright, Sean, go pre-op, reo check. Second tab. Yep. Drop down to real registration. Yes, sir. Alright, don't click it yet. So while you're on this page, I'll tell you most of the time, like turn your wrist in toward the robot. So turn your, without hitting the trigger, turn your wrist in without moving forward. So bring it back and then just your wrist. Just right here. This part. All we're doing is making sure that it's going to be in view of the camera. Because the first move you'll see will be back and toward you. So if you start off with it already outward, it's just going to disappear from you. So then Sean, go ahead and click start, please. Right side. Yeah. Awesome. All right. So see the cube in the air? You're just going through that cube. And then each one of those lines, like the blue line that you see, that's the track that the robot's basically keeping it at. If you try to go outside of that, it won't let you move in that direction. So at that point, please don't fight the robot. Just go where it wants it to go and just go with the flow. So first move, I'm going to do it here with you. This is backing toward you, so you just go like this. Yep.
This is where all those video games come to your
Yeah,
advantage.
they're gonna be better at it than we were. Straightforward. So once you hear, it's 2 beeps. Once you hear the second beep, you can go to the next one. So you go straight forward on this one. Yep. 1 beep. 2 beeps. Now you can go to the next one. Straight down.
So this is just like calibrating?
Exactly.
So it knows where it is?
Exactly. When we're done with this,
Go ahead, straight back.
yeah. When we're done with this, it creates a relationship. We're eventually going to put the saw blade on. It's going to create a relationship where the tip of the blade is to that other array.
Got it, girl.
And if anything changes at any point, it tells us it's not safe. Because if it does, and we cut on the patient, we cut their leg off. So, I mean, not, but you can cut in the wrong place. Like, seriously, you could do some damage.
Straightforward now.
Does that happen?
No, we have the checks in place for it not to. Yeah. Let it settle till you hear the second beat. There you go. There you go. Alright, nice. So now you pass the cue. Good job. Turn the whole thing down, like it's showing on the screen. So like you're going to shoot at your foot. Yeah.
Got your array.
Boom. And then take a step forward with the whole thing. So it's you on the camera. Perfect. Stay there. And then, Sean, can you click start verification? Thank you. So you see that? You see the bottom right? Tiny numbers. I don't know why they're so small. But it says 0 degrees.
Yeah.
You're going to start turning the handle up, and you'll see it till it counts up to 120. So start turning it up the way you were. Yep. See how it's counting up? Go to 120. Hold it. Hold it there. Perfect. So green numbers are good. So it's registered. Go back to pre-op check, Sean. Second tab. Yep. And then real setup. Yep. Now you can hit the trigger one more time. And it's gonna
hold it.
Hold it. Yep. And it's gonna take you to the starting point. Okay. So that starting point, that's the starting point for 2 things. It's the starting point for the registration, and it's the starting point of where the robot needs to be to then hover over the patient's knee. So basically the patient's gonna be laying down with their knee bent at like 90 degrees when we're ready to bring the robot in. And then we gotta bring this in to where it's 1 fist above the patient's knee. So that's why we need it in that particular spot. So, yeah. All right.
Young.
Yeah, no, I burnt myself out.
Yeah,
Sorry,
exactly. That's what I'm
years.
saying. Yes.
Yep.
Yep.
Yeah. So, anyways, before we start, so basically at this point, the surgeon will come in, you'll set everything up, drape, he'll make an incision, get down to what he needs to see, and then I had this set up for a demo because it's like kind of hard to do, so I just always leave it. So basically the surgeon will put in these pins on the tibia, pins on the femur. That's done with this attachment. Are you guys familiar with the drills, the power?
Not,
No.
yeah, we,
So they'll be, do you guys know like Home Depot drills and power?
Yeah.
It looks exactly the same. The same.
Yeah.
So, yeah, no, seriously, you know what a chuck key is? That little T-handle that you tighten up?
Yeah.
Like a bit?
Yeah.
That's exactly
Okay,
what
it's
these-
exactly what it looks like. So you chuck this up on the end of it, and then this, like, it's square on the inside, so it'll hold onto these pins and it'll drive them into the bone. So that's it. So once he does that on both sides, there's these guides for it. It's easier for him to do it as he's putting it on, but these will go on here. This will go here.
What are these for?
These are stabilizers and guides, right? So like, let's say he was putting in the pins from scratch. He'd go in, do 1 pin, and then he'd take the sleeve, slide it over the one that he did, right? And then do the other one. Because it's real easy here on a sawbone with like nothing in the way. But once there's like blood, skin, tissue, everything in the way, you can't really see. And then this protects the skin also, so it doesn't get caught on the pin. All right. So that's done now. So all right. So can you pass? Actually, let's start with grab this piece and grab that piece. Yeah. So right here. All right. Time to put our surgeon to work. So pass one of these to our surgeon. Alright, so just turn it with your fingers so it's tight back there. Perfect. Take the blocker right. Yep. Put that, this end, right over the top here. And then make it, see this camera right here? You're going to make everything face this way.
Also, you guys are doing that after a while, after your surgeon drops his two tibia pins in, he's going to expect you to put that jig on. He's going to want it on.
You want this to face that camera perfectly, right? So the way you do that is by unscrewing this slightly and unscrewing this slightly, right? And now play with it, make it face that camera. So whatever combination you have to do, yep. There you go. Cool. Yeah. Yeah. And then, keep twisting. So that might be a little high. Yeah, you got it there, perfect. All right, last thing to look for is, you saw how there was teeth? So the teeth here and the teeth in here, make sure they're all into each other. Proper word is interdigitated. All right, cool. Now take your screwdriver and you're gonna tighten up all three. So that one, and the one with this thing. Tight. Like tight. Because if it loosens up at any point, we gotta like restart the registration on the tibia. So it's a big delay. So yeah, we want those real tight. I'll tell the docs to put their hand on these pins right here. And when they're cranking, they're not cranking the pins out of the bone, they're supporting the pins. Yep, perfect. All right. So I told you it was a lame job. Are you tired?
I am having a great time.
Okay, cool. All right, so let's go ahead and do the same thing on the finger. So yeah, so this one bolt toward you, one bolt proximal. So yeah, exactly. Nice job. Good job with the proximal. This still done?
That's Chrissy.
Yeah, that was like a year ago.
Week one?
It's like, yeah.
Hopefully week one. All right, cool. So on this one, loosen her up a little bit, make it face this way. And let me show you a trick so that it's easier to put that on there. Kind of lock it up roughly where it has to be so it's not swiveling around while you do that. So take that. And now plug that in right over the top on this side here. It's not that cool after a while. I said it's not that cool after a while. All right, so take this and face it toward the camera. So basically, point at this right here. So
Yeah, to do the.
if you loosen them just a little bit so that it moves, makes it easier because it doesn't like all wobble everywhere. Yep, top one.
There you go.
Cool.
Yeah, yes, that brings back
That was
exactly.
right.
I know what that
Perfect.
is. It's the damn lens loader.
And sometimes it won't even be the
Yes, it
surgeon
is.
doing this. Like Sean
Give me
will be doing this
nightmares
sometimes.
in this
Or
room.
like a lot of times actually.
I got yelled at many times.
And then, you know, because the doc is here working on the incision, and then the doc's already put in the pins,
Yeah,
and
they
he's like,
do
all right,
it.
Sean, start doing this.
Every Tuesday, do about 10
All right,
cataracts.
so go ahead and tighten everything.
Was on
You
the
won't
floor.
be expected to do stuff like that, like right off the bat. Sean's a
So the
first
basic.
assist, so
Like, that's pretty
that's
cool.
why he'll be up there.
That's like-
All right, perfect. All right, then
Always keep a good grip on those pins when you're tightening down, because if you torque and you don't have a good grip, you're either gonna bend the pin or it'll fall out of the patient,
yeah.
and that's a problem.
Cool. All right, so once you have all your arrays on there, the next step would be these checkpoints. Put those in. So obviously they're in already. There's a checkpoint driver. Give me the other blue handle, please. Yeah. So basically how this works is you pull back a sleeve, checkpoints. There's a checkpoint out there. Yeah. So this is actually good for you guys to see
Yeah.
and play with, because the way it works, you'll put one in, the doc will put one in, and he's going to give you the handle really fast and reload the other one.
He's not even gonna give you the handle, he's gonna pull the trigger.
Yeah, and you
Pull
gotta
it
do it
back,
here.
he's just gonna go like this, he's not even gonna be looking at you, you're gonna say go.
So if you had a little too much coffee, this could be challenging. But
Like,
luckily, I'm struggling right now. I need some.
Pray for me every 4 rounds.
Alright. So at that point, you'll put tibia and femur checkpoint. The point of these is you'll see when we start registering, it creates a relationship until we fix it, figure out what's going on. So remember how I was saying that, like, if the robot's not registered or something moves, it can cut in the wrong place and do some damage? Same thing. If one of these moves, it will lie to the robot. The robot can be correct, but it will lie to the robot and tell it that the patient's femur is over here rather than right here. So when it starts cutting over here, you take out the MCL, for example, the collateral ligament on the medial side. That'll be very bad. Yeah. So that's why all these checks are, as long as the rep does their job and doesn't cut any corners. So anyways, once this is all set up and good to go, now, you know how we registered the robot? This is registering the knee, okay? So what we're gonna do,
Sharp. That's a good point. Beware, one's sharp, one's not. I stab myself many
Yeah,
times.
watch. The blue one is sharp. Your tip is sharp. It will go through your glove. The green one is blunt.
so hold it.
My belly is.
See that divot right there?
Yeah.
Put that. So the deepest part. Yep. And face everything toward the camera. Alright, cool. That was easy. So basically it's it's never that easy, right, Brad?
No, it's not.
Dude, we should hire her.
You're a natural. Look at you.
Alright, so anyways, sometimes it's a struggle, but basically it's making sure that all these are down and that this probe is not bent. And same thing with this one. Not bent, everything down. And it's calibrating the probe to make sure that we're going to give the system the right info. Yep, perfect. Yeah. Good job.
Xbox.
So then, once that is done, now we can, and that's done like right after registering the robot. I actually forgot, but yeah, like we could do it at any point, but
What are
ideally
these
with that.
for?
You'll see. So that's how we're going to register the whole knee. So, anyways, we still got our doctor. Okay, cool.
Get in there, doctor.
Yeah. All right. And then we can trade out a few times because there's like a lot to do here.
Yeah.
All right. So this is where you shine.
32 for the knee, 24
This,
for the
this part right here, try to keep
How do you know that?
femoral head.
I never
like,
counted.
without moving at all, and they're going to rotate the legs. That's not easy to do.
Okay.
But try.
You
'Cause
got it, Brianna.
If not, like it'll kind of throw off. All right?
Okay.
Well, let me know if
All
you're.
right, doctor, so go ahead and pick up the leg.
Her right side was hurt.
Yep. And then I'm going to hit capture, and you're going to start rotating the leg.
That's right.
Yep. Rotate it around the center of the femoral head. So basically, yep, flex it up, extend it back out. Yep.
Oh, okay.
Do figure eights, do circles, do whatever you have to do to give it a little rotation.
You can be aggressive.
Yep. Well, I mean,
You know what I
we don't
mean.
have, no, I know, but we don't have a real hip. She's holding it. So it's actually off the femur, so you gotta make the femur move. You got your knees
Brianna.
grounded? Alright, Brianna, hold on tight. So go like that.
Oh, okay.
So like figure eights. Yeah, perfect. Good job. It passed. Alright, cool.
I have 5 kids.
That was.
You're used to pinning things down.
Oh, yeah.
Alright, so now take your green probe. Yep.
No, doctor. Let someone pass it to you.
Yeah.
Oh,
You're too
okay.
good to do that yourself.
Dr. Connor's here.
Alright, so take that green probe, and then you see on the screen the medial malleolus? So it'll be the inside of the ankle.
Keep checking
Yep.
on there with him.
Yeah, no worries, buddy.
So go ahead and touch the inside of the ankle. Yep. Right there. Turn the probe to face the camera. And I'll capture that. Okay. Do the same thing for the lateral side. Yep. You got it? Let me know.
Yep.
Yeah? Alright, perfect. Alright. Bring that back down. Yep. And then you're going to go into the femur checkpoint. So that little thumbtack that we put in the femur, you're going to put the tip of the probe right in there. Yep. I'm going to capture it once, you come out of it, and then right back into the same one. The reason why we do it twice is to make sure that when we captured it, the dog just wasn't like holding it near it and not in it. Because then when we go back to recheck it, it's looking to be back to the same spot. Right? So if you start off wrong, it's going to show up wrong later. So,
Is Taylor in a room?
same
No.
thing.
Okay. I have to go watch her.
Just ran 10 throws.
So, alright, out and in.
Oh, from lipoma.
And this is all so easy because there's like
Well, yeah,
no
they're
tissue, no
checking
blood.
it.
Yeah.
But they're like digging around with retractors, trying to get it all in there. They can't
Not
see
good,
sometimes.
I did
Some docs make it look really easy. Some make it look so hard. You know, yeah, it depends on.
I dealt with that aspect.
You'll notice pretty quick. Not all docs are equal.
Yeah.
Yeah. All right, cool. All right, let's rotate some doctors through. Who else is your doctor
You
next?
could send them here. We'll
Jump in?
work
Alright,
on that.
cool. So take a
Sarah's-
blue probe.
Sarah's they don't let us do that.
Alright, and then you see these dots?
Here,
Alright, you're gonna do all the dots that are up here. So where is this in relation to that bone? Can you tell? Yep, exactly. So go ahead and touch that spot. Don't push into it, just rest right at the surface. Okay? I'll capture for you. Move to the next one.
That's what we did in class.
Go. A little more.
Do one, teach one.
Okay?
What if you're not 100% accurate?
So
We graduated
this pattern is ideal.
2007, so
It's because you're screwing up.
So you've never used one?
Put it
So
in.
go forward a little.
Okay.
Yep. So once you see the yellow, squeeze, hold, moves you into spot on its own. Re-squeeze.
Oh, that's pretty neat.
Yeah.
Yeah, when I started, we didn't have this.
Alright. Anybody else who hasn't gone yet? Anybody else want to feel it?
Just do it, it's fun.
Do it now because it's the only time you'll be able to do it.
Yeah. You'll never be able to do this again. So
I don't know, maybe we'll.
maybe you get done with a cool doc that